Good evening, and thank you for joining us for this week's Community Leader Call. My name is Tomas Salmonte, and I'm Deputy Chief of Staff to Mayor Muriel Bowser, and we want to thank you, as always, for joining us for our weekly calls. Today, you'll hear from Dr. LaQuandra Nesbitt, our Director of the D.C. Department of Health, as well as Dr. Christopher Rodriguez, our Director of the D.C. Department of Homeland Security and Emergency Management Agency. Shortly, we'll start to take your questions. So if you have any questions now for our speakers, you can press 0, and you'll be entered into our question queue. As well as we want to remind you that for all of the most up-to-date information and resources related to the district response on coronavirus, you can visit coronavirus.dc.gov. That includes the updated list of hotspot states related to the mayor's order on travel and quarantining. So you can find that on coronavirus.dc.gov, which was updated this Monday. So we'll go into Q&A just so that we can get to you all to your questions quickly. So if you have any questions, you can press 0 now, and you'll be entered into the question queue. And again, we are also broadcasting today from live on all the mayor's social media networks, as well as DC Channel 16. So if you have any questions for us, you can, if you're joining us by phone, you can press 0. But also, if you have any questions and you're watching from our social media accounts, you can ask any questions on the mayor's social media accounts as well. So we'll take questions from both callers and from those on the mayor's social media accounts. All right, the first question is going to come from our social media account, and this one's for Dr. Nesbitt. Dr. Nesbitt, the first question is related to the quarantine mayor's order and the updated travel list. What should a resident do if a state they had traveled to is no longer listed as a hotspot state? Should they continue to quarantine?
So if you are in the middle of a 14-day quarantine when the list is updated, on a Monday, the list is updated every 2 weeks on a Monday. If you are in the middle of a 14-day quarantine, when the list is updated, you should continue with your quarantine, even if the state that you had visited previously is removed from the list.
Thank you, Dr. Nesbitt. Again, we will remind everyone as we wait for some questions to come in, you can press 0 now to be entered into our question queue. And we'll get to your questions. They're coming in. All right. And just want to remind everyone, you can press 0 now to be entered into our question queue. Or if you have any questions related to and you're watching on the mayor's social media account, you can ask us on the mayor's social media account. This question is for Dr. Rodriguez. Will there be any changes to testing with the upcoming weather event?
Thank you for the question on the changes to testing based on the weather event. So this afternoon, based on some of the thunderstorms that we were expecting in the area, this evening, we canceled our firehouse testing sites, and we will continue to monitor the weather for any additional changes to our testing posture over the next several days. We are expecting a lot of severe and extreme weather over the next several days, so please stay tuned and follow the mayor's social media accounts and watch the news to make sure that you have the latest information on the status of our testing sites.
Thank you, Dr. Rodriguez. The next question is related to the next phase. If the resident's question is for Dr. Nesbitt, they've noticed that we have not updated our days related to community spread and moving into phase 3, and wondering if there's an update related to that.
So thank you so much for the question. We appreciate when people are following our data very closely. The coronavirus.dc.gov site is the best way to stay informed of our data trends, and we have a number of charts that are very useful for residents. You will notice that we used to count days of decline, but we had to temporarily suspend counting days of decline And if you look at the graph, the line that shows us days of decline, you will see that it has been in an upward trend. Because the graph is in an upward trend, it is impossible to count days of decline, and 14 days of decline are needed for us to move into the next phase. When we moved into phase 2, we were very intentional in communicating to people that we thought we would be in phase 2 for quite some time. And the reason why we wanted people to have some expectation management about being in phase 2 for quite some time is that we don't only look at days of decline as a reason to move from one phase to the other. We have to really understand the nature of the pandemic. And so how much community spread that we have, and community spread is not only measured by days of decline, it's also about how much virus is circulating in our community. And so getting into containment, which is where we need to be to move into phase 3, good markers and indicators of that is how many cases we're reporting on a daily basis. So you should essentially think about that in terms of us being in very low numbers. I recall having a conversation with someone and they're saying, we're only reporting 30 cases a day now. That's not good for a city our size. We should be more in the single digits to really be in containment. Our cases should be more like clusters, so seeing more of our cases related to each other. So we have a metric for that. It's metric 1C. So we'll need to see more positive trends and more metrics, not just the days of decline, before we can move into the next phase.
Thank you, Dr. Nesbitt. We'll go to our next question from online as well. And want to remind everyone, if you have a question, you can press 0 now to be entered into our question queue on the phone, as well as if you have a question, you can ask this directly on social media. This question is related to contact tracing data. The resident says that they saw Governor Hogan release some different trends related to contact tracing in Maryland, wondering if there's been any changes to the trends in the district of what we're seeing with the contact tracing and activities that may be leading to more cases in the district.
So unfortunately, we haven't been able to observe similar trends in our data yet. Many of our cases are still community transmission cases with an unknown exposure, or their exposures related to someone's workplace or household contacts. And if we're able to make very precise things like they're related to people attending large gatherings, we'll be able to disclose that information to folks.
Thank you, Dr. Nesbitt. We're next going to go to Eleanor in Ward 8. Eleanor, your line is unmuted for your question.
So this is for, I am going on vacation on Saturday, and I have an compromised immune system, and I'm just wondering what I should do after I come back from New York.
So thank you for the question. We don't provide direct medical advice to people on this call, so we would recommend that you speak with your doctor, who would have the best knowledge about your specific health condition and would give you advice not only about what you should do when you return, but about the specific precautions that you should take related to your health condition. There are definitely things that we want everybody to do, not only when they travel, but simply as a function of us being in a pandemic. And those are things like being sure to wear a mask, keeping 6 feet of distance from people who are not members of your household that you are in contact with, being sure to wash your hands frequently, and when you wash your hands, wash them for at least 20 seconds. Being sure to use alcohol-based hand sanitizers that contain at least 60% alcohol when you're out and about and you cannot wash your hands. And I think it's critically important for people to just pay very much attention to the things that they're doing when they're out and about. So if you're going out and about, people forget to not put things in their mouth without washing their hands. So when we talk about washing your hands frequently, that includes every time that you're putting something in your mouth. Your mode of travel is extremely important. So, traveling alone in a car is recommended over the use of mass transport and other things when you can be in close contact with people whose COVID status is unknown. It's important for people to constantly be reviewing the list that we publish because as states are updated that are considered to be high-risk areas, that could happen while you are on your travel, and you would be expected to self-quarantine when you return. But again, we ask that people speak with their healthcare provider about the specific precautions that they could take that are unique to their individual health issues or own diagnoses.
Thank you, Dr. Nesbitt. We're next going to go to Eddie from Ward 2. Eddie, your line is unmuted.
Hello?
Yes, Eddie, we can hear you.
Thank you much for all the information that all of you disseminate to everybody. It is most helpful to have people involved, and I really appreciate all these conferences. I am a medical doctor, and I am aware of a company called Kinsa, and they actually distribute thermometers, and people who wear those thermometers have their temperature recorded and centrally via internet sent, so they actually can have a map of people who have fever. They have programs with the city of Philadelphia and city of New Orleans to help them track down people with fever and thus diagnose early possible suspicious cases. Could DC do that, and who is the person who could possibly be contacted about that?
So thank you so much for sharing. Any information that you would like us to review about innovative approaches to responding to COVID-19, including medical technologies, innovative approaches for surveillance can be sent to coronavirus@dc.gov, and a member of either the public health team or the emergency management team, whichever is most appropriate, will review that information. So we thank you for the question or for the comment and sharing that information, but please feel free to forward that to coronavirus@dc.gov. And for any member of the public that has something that they would like to share with us, be it a piece of information technology, emerging literature, or anything in emergency management, can always feel free to send that information to the address coronavirus@dc.gov.
Thank you, Dr. Nesbitt. We're going to go next to Chuck in Ward 2. Chuck, your line is unmuted.
Yes, good evening, Dr. Nesbitt and Mayor Bowser. Thank you first of all, for your service to our community and for doing such a fantastic job in leading this coronavirus battle. My first question is this. In using the excellent data that is on the dc.coronavirus.gov website in the Phase 2 microsite, the guidance indicates that employers in the district should have no more than approximately 25% of their capacity in their offices at this time. Is that a correct interpretation of the guidance?
I don't have the guidance document in front of me, so I don't want to misspeak. There's been tons of guidance documents over multiple phases, and Tomas is looking at me, and I'm not sure if he's queried it. So I don't want to give you to validate something that you are reading that I am not also reading.
Yeah, just to jump in here. So I think the question is related to capacity limits in office buildings. The guidance doesn't specifically set out a limit of amount of people in, an amount of people in the office. However, it does have guidance related to spacing, mask wearing in conference rooms, et cetera, as well as the mask order related to if you're in your own private office that nobody else can enter, you can be without your mask, but every other every other office, every other part of the office, you should be in your mask. There's also guidance related to recommending not having areas of congregation such as break rooms or some of these other areas where I know that our EPIs have noticed that can be a high risk activity. So we highly recommend that you go through at coronavirus.dc.gov /phase 2 to look through that guidance at length.
So what I will say to you, and the reason why I didn't want to speak to a specific, we had lots of discussions on percentages, per capitas, or 5 feet per, or 5 persons per X number of square feet, and lots of discussions around those particular types of criteria for our guidance documents. What we want to make sure that people understand very clearly is that we know that there is a benefit to extending telework for as long as possible in terms of helping us to reduce the transmission of COVID-19 in the District of Columbia. And in our guidance documents that are geared toward employers in certain business environments, and particularly those that operate office buildings that are not consumer facing, that do not offer direct services that require people to come in and purchase things or receive goods and services directly from individuals in those office buildings, we can have an advantage of having those businesses remain in a telework posture for as long as possible. We have done that with the District of Columbia government operations, assessed each one of our agencies, each division in our agencies at a very granular level to determine how many of our employers, which divisions can remain in a telework posture to be able to allow for social distancing, decreased congregating in communal spaces, et cetera. Whereas if we were to offer this blanket 25% of your workforce, et cetera, it would then require us to have a more detailed and judicious approach to understanding the type of business that you operate, et cetera. So we felt it was more prudent to, we could give you a guiding space to say 25%, which would clearly indicate that your building would not be at full capacity. But then there are other things that are more salient and important in terms of making sure that people, if they share office spaces, that they are back to back instead of facing each other, that spaces are 6 feet apart, et cetera. And that there is cleaning supplies and disinfectant and hand sanitizer and all of those things that are readily available for employees, and that you have a process in place for employees to know who to contact if they are sick, and for you all to know how to communicate with DC Health if you need support with knowing how to deal with an employee who is COVID-19 positive.
Thank you, Dr. Nesbitt. And again, just want to remind everyone, all of those guidances that are, I like to say, living documents, because we continually are updating and working with the full team at DC Health to reflect any necessary changes to the guidances. Those are available at coronavirus.dc.gov/phase2. We're next going to go to Cecilia in Ward 3. Your line is unmuted.
Hi.
Yep.
So I was reading the guidance about testing on the website. It says you'll get test results back within 5 to 7 days. And I know it advises you to self-isolate and whatnot while you're waiting for your test results. But containment is really difficult when you start to get those really long test turnarounds. So I was wondering if there was a plan to reduce the amount of time it takes to get your test results back.
So thank you for the question. This is Chris Rodriguez. District government has been very forward-leaning in terms of making sure that the test results from our sites are given back to our residents very quickly. We are aware of some instances in which residents had to wait a longer period of time. But I know that Dr. Nesbitt and the DC Health team look at the turnaround times for tests citywide every day. They're constantly looking at that data. We are also working with our public health lab to make sure that they have what they need to continue to have really quick turnaround times. The average turnaround time that we have district-wide as of today was about 3 days. And so we've taken a lot of steps, including bringing on additional lab capacity to make sure that we are getting those tests back to residents very quickly.
Yeah, and I will add to that we definitely appreciate the challenges that long turnaround times pose, both for people who are anxiously awaiting results and understanding their COVID-19 status and the emotional and mental stress that causes for many people. The other piece that I will add to that is for anyone who has been put in a position to need to know their COVID-19 status, that individual needs to be quarantining. Anyone who has a need to get a test has a need to quarantine. And quarantine is for 14 days. And so the test turnaround times in the district have not been as long as 14 days. We've been very fortunate to have not gotten that far. And so we would ask that people also think very much about the need to have a test, also coincides with the need to quarantine. And the need to isolate if you are in fact symptomatic. So keep those kind of paired concepts in mind.
Thank you, Dr. Nesbitt. We're going to go next to Allie in Ward 6. Allie, your line is unmuted.
Hi. So my question is kind of on the other side of needing a test. So I was wondering if you can get tested for COVID-19 if you're doing it as a precaution, as an essential worker, so meaning you're symptom-free, haven't come into contact with a known positive case, and if that's allowed with mandatory quarantine in the district like you just talked about until you get that negative result or 14 days, would that then deter people from getting proactively tested because they aren't able to wait days for results?
So as a practice, we do not recommend that testing be a requirement for employment, entry to employment, or return to employment for all types of employment. So there, for office-based jobs, for employers to require that individuals produce a negative test in order to return to the workplace if they have been in a telework status. We have not recommended that. There are, however, certain employee statuses where we have recommended, and our guidance documents have highlighted this, where there is ongoing surveillance of those populations or those particular employee groups to ensure that those individuals who could potentially be asymptomatic and posing a risk to their work environment have routine testing. So in the spirit of your question, we have, and I have recently issued an order to make this category of employee, to make it very clear that the DC Health does support testing of that population. But many of those employee groups are very clear already on the need to have testing in that population. It tends to be in congregate settings, congregate care settings. Many healthcare facilities, detention centers would fall into this category, as well as our shelter population. And so employees who are in that environment and asymptomatic would be appropriate for having testing routinely, and we have given guidance on what it means to be routinely tested in that category. There are, for other employees who are deemed essential, again, routine testing would not be recommended unless there was an exposure for that employee. They had come into close contact, something had happened in that environment. There can be instances, even when the employees are asymptomatic, that they would be screened through a surveillance process, and as your question states, that they may or may not be permitted to continue working while test results are pending, depending on the context of the exposure. But all of those things will be dealt with on a case-by-case basis in consultation with DC Health.
Thank you, Dr. Nesbitt. We're going to go next to Belinda in Ward 4, and we're almost out of time, so we just have time for a few more questions. But Belinda in Ward 4, your line is unmuted.
Thank you. First of all, I want to thank you for all of the hard work that you have been doing for Washington, D.C. residents. My question is concerning the outdoor pools. I know the outdoor pools were open for a little while, and then they were closed down again. What was the reason for closing the pools, outdoor pools down again?
So I can start to answer that, and Director Rodriguez can finish answering it, depending on how the responses received. So DC Health works with the Department of Parks and Recreations on the regulation of pools, and every year we work with great enthusiasm to kick off pool season. As part of that preparation, the pools are filled with water. They are tended to, all structural repairs are made. And so there was the appearance that pools were open because pools were prepped for the opening of pool season because we had great optimism that our public health indicators would move in the right direction, that we would be able to open our pools and allow our residents to enjoy pool season. Unfortunately, our public health indicators did not move in the direction that we would have liked them to move for us to open pools safely for our residents to enjoy. What we have now is a situation where many residents have seen our pools be filled with water and look ready, or that our pools were open, but they were never open. They were ready for inspection by DC Health. They were ready to be open because we had worked very hard as a government to do so with anticipation that we would be able to bring you all a pool season for 2020.
Thank you, Dr. Nesbitt. We're going to go next to Gail from Ward 5.
Hi. First of all, thank all of you for your service. I really appreciate it. And I'm calling on behalf of neighbors who have purchased vehicles. This is a DMV question. They purchased vehicles not from a dealership, but third party. They cannot get an appointment due to COVID-19. They cannot get an appointment at DMV to register the vehicle and have tags issued no sooner than January 2021. They would like to drive their vehicles but cannot do so without tags. Do you have any suggestions?
Thank you. This is Chris Rodriguez. So in phase 2, one of the services that was brought back online was the DMV, and I know that they have a lot of services that are online, but what we can do is we can run that to ground for you and make sure we have an answer. I do know that there have been some delays, but working very quickly to fill those gaps. But we can get back to you on that as well.
Yeah, and I know that, and this is on the coronavirus website as well, but DMV did announce an extension of for any documents expiring on or after March 1st until 45 days after the public health emergency ends, whenever that date may be, the 45 days after. But that includes the extension of the expiration date for driver's licenses, both renewals and first-time licenses, non-driver identification cards, vehicle registrations for both renewals and first-time registrations, inspections, ticket payments, and ticket adjudication responses. And so know that that is in place, and that, as Dr. Rodriguez said, we will, the high frequency of requests of the appointments at DMV, we will follow up with the team on that as well. But we thank you for that question. So I believe that's all we have time for today. But we want to thank you all so much for joining us for this week's call, and want to remind everyone again, for the most up-to-date information and resources related to the district's response on coronavirus, you can go to coronavirus.dc.gov. I want to thank Dr. Nesbitt and Dr. Rodriguez for being here with us this week and answering your questions. And again, I want to remind everyone all of our guidances, any travel guidance, any of our mayor's orders, all of that information is available on the at coronavirus.dc.gov on the phase 2 site page on that on the site. So we want to make sure that you go there, familiarize yourself with all the guidances, and read up on that. As well as make another plug, as I do weekly, to remind you about the census. So we hope that you, if you have not completed your census, that you complete your census. Make sure that you are counted. Make sure that your friends, your family, your neighbors get counted. I've added it to my daily routine of asking everyone that I chat with in my day-to-day, have you completed your census? I hope you'll join us in doing that. and asking all of your friends, family, neighbors, residents, whoever you run into at the convenience store, have you finished your census? Have you completed your census? So let's all do our part to make sure that we get counted and the district gets our percentage up in our count. So thank you all so much for joining us, and we'll talk to you next week.